Welcome back to Kinship Trading Part 2. I'm happy that you're listening and watching. And let's get into the subject, sexual abuse, Part 2. What we will be talking about is trauma, and then the symptoms of freeze and dissociation, and the therapy options. What are the criteria for post-traumatic stress disorder, or PTSD in short? Researchers said that, of course, one of the primary criteria is that a person has experienced trauma. Then there are the symptoms of re-experiencing, the symptom of avoidance, changes in thoughts and feelings, and overexcitement have been present for at least 1 month in the person. And third, the symptoms place a heavy burden on the person and/or lead to restrictions at work, in personal relationships, or in everyday life. Post-traumatic stress disorder is a common and understandable reaction to horrific events. Many of the symptoms of this disorder occur in almost all people after a traumatic experience. People differ in how quickly they recover from traumatic experiences. Post-traumatic stress disorder can therefore be understood as a disorder of mental recovery from traumatic experiences. What is the occurrence of PTSD? The results of numerous studies clearly show that the development of PTSD is not a sign of weakness or personal failure, but can, in principle, affect anyone who has experienced a traumatic event. 8% of all people suffer from PTSD at some point in their lives. It is one of the most common mental disorders. What are the risk factors for the development of a PTSD after trauma? Since we know that not everybody does develop a PTSD after being traumatized. The risk factors are characteristics of the trauma, being criminal or sexual violence, the perception of the trauma, the experience of fear of death during the trauma, the feelings of powerlessness, feelings of constantly being at the mercy of others. The blocking factors, a critical attitude of caregivers towards a trauma or traumatized person, not being taken seriously, and previous traumatic experiences, people who have experienced trauma before. What are other disorders that can develop after trauma? We looked at some of these already in part 1, but we will repeat. Depression or grief. It can come to an increase in alcohol, drug, or medication use. An addiction can develop out of that. Phobias and panic attacks can develop. Problems in interpersonal relationships, problems with the self-image or dealing with feelings. A borderline disorder can develop. Physical limitations and material limitations, such as loss of property or job loss. And I want to share with you how the trauma is stored in memory. This is something important to understand, especially for people who have been sexually abused or gone through a trauma. The characteristics of trauma memory can perhaps best be summarized in an image. You can imagine the memory as a cupboard or closet. Everyday memories are stored in this cupboard by first folding them neatly, processing them, and then organizing them in an appropriate place. Such as linking them to similar memories and relevant information. Therefore, these memories can be retrieved when needed, but they rarely fall out of the closet on their own. The storage of trauma memories in the memory, on the other hand, can be compared to a situation where many things are thrown into a cupboard very quickly without being organized, so that the door cannot be closed completely. The door will therefore open frequently and things will fall out of the cupboard again and cause the reliving of the trauma. To understand trauma, we have to remember, during the trauma, those affected are overwhelmed with the processing of the experience. This leads to sensory impressions, feelings, and physical sensations of the trauma being stored in raw form in the memory. The memory of the worst moments of the trauma is also poorly linked to information that is important for its meaning. For instance, if the outcome of the event was better than feared or reasons for one's own behavior. The memory can be triggered by many different key stimuli, which are often simple sensory impressions. The re-experiencing is accompanied by strong emotions and physical sensation and gives the impression that the trauma is happening again, here and now. And I want to emphasize the freeze reaction, which is part of the trauma symptom. The freeze reaction is characterized by increased alertness, hypervigilance, and immobility. The reason for freezing is the hope of not experiencing the threat or trauma again, be it emotionally or physically. The body falls into a kind of frozen state. In the brain, the experience is broken down into individual parts in order to initiate a repression of the extreme memories. Another symptom is the so-called dissociation. The dissociation as a protective mechanism when experiencing sexual abuse takes place. Those affected go into another world of thought so that the body does not have to be felt. This can lead to rejection and even to a loss of awareness of bodily sensations. And patients often express the inability to feel bodily functions, or they have an overstimuli from certain bodily functions, pain in the abdomen or pain in the back. Another consequence we've already addressed is the change in self-image and the change of the worldview. Traumatic experiences often lead to changes in self-image, worldview, or the perception of other people. These can contribute to the feeling of current threat. Examples of common thoughts after a trauma are, my life is ruined forever. I can't feel close to anyone anymore. I can't be safe anywhere. And most stressing is, I can't trust anyone. Now, since we as kinship are a church group, you can imagine what that does to somebody's image of God. And how people who go to church and have been traumatized struggle with a healthy image of God. And this must be mentioned here so people understand why they can also be struggling spiritually after trauma. People who have been sexually abused also change in behavior, or people who have been traumatized. Many of the things that people do after a trauma to get a grip on their problems are actually relieving in the short term. In long term, however, some of these behaviors make it more difficult to process the trauma. The relieving behaviors include, for example, strong avoidance of trauma-related memories, feelings, places, or situations, excessive precautions, social withdrawal, rumination, constant vigilance, or excessive use of alcohol, drugs, and medication. I also addressed in part 1 biological factors. And I want to repeat that here as well, because it's important to remember that it's not only the soul and the emotions, but also our body is affected. Trauma not only has an impact on people's experience and behavior, but also leads to measurable physical changes. It leads to the increased activation of emotional brain regions. It leads to reduced activation of brain regions for conscious and linguistic processing. That's why people who have been traumatized or sexually abused have a hard time with their memory or with expressing their feelings, because the verbal expression is reduced. And they have an increased level of arousal in the autonomic nervous system and pronounced startle reflex. This is heartbeat, sweat production, nausea, and so on. Fortunately, these changes are all reversible and disappear after recovery from post-traumatic stress disorder. We now come to the question, what can you do about traumatic stress disorder? Or what can a person do who is affected by sexual abuse and post-traumatic stress disorder? A person needs to be aware that strong reactions to trauma are normal. A person needs self-care, needs to consciously look after oneself and reclaim everyday life. A person needs to follow up on a sleep hygiene. Accept and demand support from trusted persons, even if this is one of the most challenging things that they need to do, because they have a problem trusting people. It helps talking and writing about the trauma. People who are traumatized need to reduce avoidance behavior and exaggerated safety measures. They need to track down the triggers of the revival. They need to learn to say no and set clear boundaries. And all this can be learned, of course, in psychotherapy, which is highly recommended for people who are traumatized. Psychotherapy has various therapies. And in practice, to treat post-traumatic stress disorder, there are two methods in particular that have been shown to be effective, namely the cognitive behavioral therapy with a trauma focus, and EMDR, which is a specific intervention method of desensitization and processing through eye movement. It's called eye movement desensitization and reprocessing. There is also good evidence for treatment according to Peter Levine's somatic experience. According to the currently valid international treatment guidelines, one of these therapy methods should therefore be used in the presence of post-traumatic stress disorder. In therapy, for those of us or you who need to go to therapy, the main phase of treatment for post-traumatic stress disorder usually consists of the following components: developing an understanding of how the problems developed and what is preventing improvement, dealing with the trauma in order to organize and process the memory, discovering triggers for the memories, conversations about the personal meaning of the trauma and changes in self-image and worldview, changing unhelpful behaviors, and last but not least, reclaiming life. Since kinship is a church group, we also need to address this subject, this delicate subject of sexual abuse, which also takes place in the church context. In the church context, leaders are primarily responsible in the cases of abuse, regardless of the behavior of those under their protection. The leaders are responsible. What measures can I recommend? Education and public communication, again and again. And this is why we are doing this presentation for kinship as a church group. Sexual assaults usually occur more frequently in narrow-minded religious groups than in the normal population. And there's also a need for protection for pastors and counselors against accusations. Do not conduct counseling alone in private rooms. This is to all ministers and pastors and counselors. Train a healthy approach to physical contact. And last but not least, an important take-home message from a famous English poet and writer, William Shakespeare. He said, "Give sorrow words. The grief that does not speak knits up the o'erwrought heart and bids it break." So train speaking about your pain. We need to speak about our emotions in a safe place, not with everybody and anybody, but with somebody we can trust. I want to thank you again for your attention, for listening and watching, and I hope you were able to take something for your situation out of this presentation. Since this is an online schooling, I needed to put in the sources for the slides. There are 2 German books. Because this will go online, many other people will see it, and they have to know where I got my information from. If you have any questions, please send them to Floyd@ponitz.org. He's the president of Kinship International, and he asked me to do this presentation for you. Thank you again, and bye-bye.